All right. So thank you everyone for being here. Welcome to day 2 of our gathering. My name is Kate Bailey and I am the Chief Development Officer of FamilyWise. And I'm kind of going to be the tech host today. So if you run into any tech issues, don't hesitate to send me a private message in the chat and I can try to help you work out those issues. So you're at the first breakout session of the day. This session is called the 2019 Minnesota Student Survey Adversity and Protective Factors Data, Broadening the Understanding of Student Experience. So we know that core adverse childhood experiences are associated with mental and physical health problems. But there are many other factors that contribute to health and well-being of Minnesotans that are both positive and negative. And during this session, we'll explore Minnesota Student Survey items and community data that are outside of that standard ACE scale, but are also associated with health outcomes. And these additional items can help your community assess local conditions and prioritize strategies to address trauma and build resilience. So I'm gonna also give an introduction to our speaker today, which is Jacquelyn Freund, and she is the Senior Research Scientist at EpiCog LLC. Jacquelyn helps communities analyze and make sense of their data to further their prevention goals. She works with FamilyWise to use local data to inform ACEs prevention programs across the state. She also works with the Department of Human Services State Epidemiological Outcomes Work Group, where she maintains their website, Substance Use in Minnesota, SUMN.org, and helps communities acquire, analyze, and interpret data relevant to their substance use prevention and mental health goals. She loves working with the Minnesota Student Survey, and she enjoys helping communities implement data-driven strategies to improve the lives of children in her home state. She lives with her wife in the vibrant Payne-Phalen neighborhood of St. Paul, and she loves her dogs, her gardens, and her neighbors. So we are thrilled to have Jackie with us today. One thing I'll say before I turn it over to her is that you are encouraged to, throughout her presentation, anytime you have a question, please put your question in the chat and I will let Jackie know as questions come up and so that she is able to respond to them throughout the session. And we'll probably end early so there will be time for questions at the end as well. But just definitely use your chat function as you have questions throughout the presentation today. So with that, I will turn it over to Jacquelyn.
All right, thank you, Kate. And you can hear me, right? Great. Okay, so as Kate mentioned before, I wanted to talk about the factors that go beyond the core 10 of the adverse childhood experiences, because we have such a wealth of data in Minnesota, both on that Minnesota Student Survey and in other sources. So the main point here is that we have the core adverse childhood experiences that are associated with mental and physical health problems for children and adults, but there are many other factors also that contribute to health and well-being of Minnesotans, both positive and negative. So I think probably if you are watching this presentation and you're involved in this group, you probably already know some of the history of the original ACEs study, but I'll just go through that pretty quickly. So the original study was in 1995 through 97 by the CDC and Kaiser Permanente. They own the data for this, this data set. So they're in charge of that, but they publish. And then also, they have given the ACEs module or given permission for other groups to use the ACEs module. So we use that on the Minnesota Student Survey and the BRFIS, the Behavioral Risk Factor Surveillance System uses that throughout the United States. And the Minnesota did take part in that in 2011. So what they found in the original study is that there's a dose response relationship between ACEs and negative outcomes. What that means is that for every ACE, there is a higher risk for a multitude of other outcomes. So substance use, diabetes, cancer, et cetera, that sort of thing, the dose response. So the original study looked at the core 10, was emotional abuse, physical, sexual abuse, domestic, household substance abuse, household mental illness, parental separation or divorce, parental incarceration, and emotional neglect and physical neglect. So on the Minnesota student survey, we do not ask about physical or parental separation or divorce, and we don't ask about neglect. So it turns out that these ACEs were associated with a number of negative health outcomes. I think a lot of them are surprising for people because we tend to think in the short term and in what's really visible for us. Our healthcare system is great at things like broken bones. It's not so great at things like mental illness or maybe anticipating things like epigenetic changes. I think people aren't really thinking about that when they take action, right? So how is this going to affect, 2 generations down the line? So on the Minnesota student survey, some of these questions were already asked from the very beginning in 1998. Such as sexual abuse, because again, these are relatively common adverse experiences for young people, but the scale itself, even though it doesn't replicate the exact 10 that were on the original survey, began in 2013. So there's a module on the Minnesota student survey that covers adverse childhood experiences, and from these we get a scale, a Minnesota student survey ACEs scale. Household mental illness was included in that scale in 2019 for the first time. So that's the most recent study that came out. And then there are some other indicators that some people have talked about adding to a scale, but have not. So parental separation, homelessness, or sex trafficking, which again, that was also just added in 2019. So I know there have been other publications by state entities that have included homelessness or the sex trafficking or dating violence in their scales, but we just include here, I'm just including the module that we have. So the ACEs questions in 2019 were asked of 8th, 9th, and 11th graders. So just to give everybody a reminder, if they've seen this data, maybe they have or haven't seen the data, this is the frequency of ACEs by category from 2019. So you can see that the most prevalent adverse childhood experience is the household mental illness, which is, has changed a lot of how we deal with the data because that was just added on in 2019. And it, included a lot more students into this category now of having one or more ACEs. So caregiver incarceration prior to 2019 had always been the most prevalent. And then the rest of them actually have remained pretty stable over the years. There's not a lot of change in the percentage of students reporting any of the adverse childhood experiences, unfortunately. So again, this is sort of the breakdown. So just over half of Minnesotan 8th, 9th, and 11th graders have had 0 ACEs, and then almost half of them have had 1 or more. So this is over 51,000 students that have reported 1 or more ACEs. And remember that this is just the 8th, 9th, and 11th graders in Minnesota that took the survey, right? So there are a lot of other students that didn't take the survey that are in different grades, et cetera. So this is a large number of kids in Minnesota that are dealing with these. So why do we use this core set of ACEs? We use it to look at the way that common traumas can affect health, right? So some of these are relatively common as you see, more than a quarter of students in Minnesota have had somebody in their household with mental illness, so they're relatively common. We use this core set so that we can compare across populations. The predictive value is very strong. Again, there's a stepwise dose response for a lot of the negative outcomes. And because a lot of these are common across populations, right? So a lot of students across the country are experiencing divorce or trauma in their households. And then again, to acknowledge that we have shared adversity, to acknowledge that the traumas have effects on our lives, but that this is common, and we see other people that have overcome these traumas and gone on to do great things, right? So the hope that we have in recognizing that we're not alone is very powerful. But here we're going to talk about how the core 10 are not the only adverse childhood experiences, right? So they're individual examples. I just put very short list on here of some of the individual examples. So bullying, dating violence, illness, foster care, and then there are population specific examples, right? So things that are going on more in the society. So LGBTQ populations, immigrant populations that were uprooted, neighborhoods that have high levels of poverty or crime, and then also racial discrimination. So these are some of the childhood experiences that are possibly less common and more specific to certain communities. So perhaps you live in a community where there's a large number of immigrants. They might be looking at different types of adversity that would be covered on the core ACEs scale. So this isn't a new idea, right? So there's been a lot of talk about expanding the ACEs model or looking at things outside the core ACEs. So Dr. Wendy Ellis spoke at this gathering just a couple of years ago and used this model. So we can talk about sort of the canopy of the tree, which is the adverse childhood experiences that would be included, for example, on the Minnesota Student Survey, right? So homelessness, domestic violence, things that are happening in the home or to the child on the survey, and then also including adverse community environments, right? So things that are more widespread, so poverty or discrimination, things also that you can't really ask students about very well. You can't ask them, oh, so how does your rent compare? That sort of thing. Let me look at my notes. And then also, so there's Dr. Wendy Ellis, and then there's also the PACES connection, right? So probably a lot of people are familiar with ACEs connection, which just turned into PACES connection. And they have the 3 realms of ACEs. So they have, again, the canopy of the tree, they have the soil, which is the community, and then they have environmental as well. So I'm not going to talk so much about natural disasters or the climate crisis. Those are topics that are way too big for me to cover today. But in Minnesota, we have a lot of data from the canopy, right? So we have a lot of data from the Minnesota Student Survey. We have the core ACEs, and then we have a lot of other positive and negative experiences that have a huge effect on health behaviors and outcomes. And all of these are in the Minnesota Student Survey. And then we also have data from the environment. So some of this is covered from the Minnesota Student Survey, but again, it's hard to ask kids about historical trauma or rent or poverty in the area. So we get these data from other sources, right? And so as we talk about this sort of in the same way that Dr. Ellis talked about it, we talk about how the nutrients for a tree are robbed through the soil. So maybe a child lives in a food desert or in a neighborhood with poor public transportation, which cuts down on economic opportunity. Or the neighborhood has high crime, which causes people to stay inside and they don't get exercise. And then children who experience housing instability and stress due to poor or expensive housing. And then we also have things like air quality, which is linked to asthma, diabetes, and impaired brain development. And then also things like discrimination, which can add to stress. And we know that that leads to mental health problems, heart disease, worse maternal and child outcomes, et cetera. So even if the family is working as well as possible, these other elements in the environment are exerting their negative influence on the families and the children. And we know also that this is a vicious cycle, right? So even things like having access to healthcare reduces crime by providing mental health and substance use treatment, among other things. And so because of the complex interplay between a lot of these factors, some of these may be considered both adverse childhood experiences, but also just be associated with a higher prevalence of other adverse childhood experiences. So the Minnesota Burfus ACEs survey in 2011 found that a number of factors were associated with a higher ACE score. So lower levels of education, marital status, unemployment, home ownership. So renters are 2.7 times more likely to have 5 or more ACEs. Homes that have financial stress, they're 4 times more likely to have 5 or more ACEs. So all of these factors have effects on health. And we're going to look just a little bit more closely at 3 of them and their relationships to health. We have a lot of national and international studies and a lot of data on the effects of these factors. So the first one we're going to look at as a community indicator is poverty. So we know that impoverished neighborhoods tend to have more environmental pollution, like I mentioned before. Air pollution is related to asthma, diabetes, cancer, obesity, and developmental delays. Poor neighborhoods tend to have lower educational attainment, fewer family supports, shorter life expectancy, higher infant mortality, food deserts, even higher rates of autoimmune disease. So poverty is actually something that's really well counted in the data. It's pretty easy to find. Kids Count by the Annie Casey Foundation, their website has a lot of data on children in poverty. So they have rates of children who live in single parent households. They have children that live in poverty. They have working parents in poverty. And so they have a lot of division. So if you want to find exactly what's going on in your community, Kids Count is a great place. The poverty rate by county, the US Census data just came out, yay. And they have poverty rates by county in Minnesota, and that's actually relatively easy to find now. They've upgraded their website. I think a lot of other data websites had been created in the past few years, maybe to make up for a deficit at the national level for their data visualization, but now the census is doing actually a really good job, and it's really easy to find data. And then we have this map here that shows the percent of people in poverty. So Ramsey County, 15% of people are in poverty. This map, if you access it at the website, all of the links are at the end of this presentation. You can change this so that it shows just children under the age of 18 or children under the age of 5. So it's pretty easy to find the poverty data for your county. So the second community indicator that we're going to look at is crime and violence. Healthy People 2030, I'm sure most of you have heard of the Healthy People program. So every decade they set out goals to meet to create health and well-being in the nation. So Healthy People 2030 divides the social determinants of health into 5 domains. One of those is neighborhood and built environment, which will include crime and violence. So crime and violence can affect health because there's less physical activity or less outdoor activity. There are higher rates of mental illness and stress-related illness. And then there's, again, that cycle that better health care reduces crime. Crime is caused by substance use and mental health issues, and then also leads to those. So we know things like when Medicare is expanded and people have better health care, violent and property crime fall. But if you want to look at the crime in your neighborhood, maybe you have more crime than other municipalities or different communities. You can look at LexisNexis has a community crime map. You can look at what crime is happening right now, sort of at the moment, or you can look at it for the past year and you can compare to different communities. And it also will tell you the type of crime that is committed. We also have, which is great, the Minnesota Bureau of Criminal Apprehension has their uniform crime reports. They talk about violent crime, they talk about DUIs and drug apprehensions, all of that sort of thing. So if you're looking for data for your specific community, you can compare how your community is to, Minnesota as a whole. Also, a lot of these data on the crime so crime and DUI and that sort of thing are also available at sumn.org. So the community health indicator number 3 that we're looking at is racial inequality. I think in the past year, maybe people have become more aware of this if they were not already aware. Racial inequality can be sort of long-standing, or it can be a result of recent immigration. So there are a lot of inequalities that are caused by discrimination, but also inequalities that are caused by not having access to education, having a lot of stress. So in my neighborhood, there are a lot of Karen immigrants, a lot of people that came here when they were probably 15 years old and were living in refugee camps and didn't have great access to education. And then even if they didn't speak English when they came here. And so they have a lot of work to do to be able to catch up. So we know that communities of color are more likely to have lower educational attainment. They have poor maternal outcomes, emotional stress, physical problems, higher rates of communicable disease. And this is even outside things like, owning property after we've gotten finally rid of the situation where there had been the commitments on homes where people of color were not allowed to buy homes in certain areas in Minnesota. So one of the ways that we can look at this graphically to show the inequality is the 4-year graduation rates, which have actually improved in the past 4 years, but the rates for people of color in Minnesota of graduating from high school in 4 years lag far behind the Minnesota average. So again, these data come from the Minnesota Department of Education, but there's a lot of data on racial inequality. So income by race and illness by race and ethnicity, et cetera, from the US Census, from Kids Count again, and from Minnesota Compass. Minnesota Compass has a great section where they talk about the different immigrant populations in Minnesota and sort of the histories of them, and a lot of the health and other indicators pertaining to these populations. So we have a great resource there. So we know what the national data say, right? So we know that poverty and inequality have outsized effects on health and well-being. And so we know how to arm ourselves with the community data, like how many kids live in poverty in our county. And then we can act on that, right? But we can also measure some of these effects directly in our own communities without setting up giant multi-year studies, just by looking at the Minnesota Student Survey, which kind of is a giant multi-year study. So the first one that we're going to look at is a correlation to the community indicator, poverty. So the MSS doesn't ask directly about poverty on the survey, but it does ask about conditions that indicate low socioeconomic status. So it asks about, do you receive free or reduced price lunch? It asks, have you skipped meals because your family didn't have enough money to buy food? And it asks if you have been homeless in the past year, either alone or with your family. So we put together a little scale, and students reporting one or more of these meet the threshold for low socioeconomic status. And this is almost a third of the students who took the survey in 8th, 9th, and 11th grades. So I'm just going to explain this graph a little bit. So students who have experienced poverty are more likely to report depression, marijuana use, and feeling negative about the future. So these are just 3 aspects that I've chosen from the Minnesota Student Survey to sort of show the effects of poverty. So I'm just going to explain this a little more clearly. So of the students who don't have low socioeconomic status, the way that it's defined here, 18.8% of these students reported having depression. And then of the students who do meet the threshold for low socioeconomic status, 30% of them report depression, right? So students who meet the threshold for low socioeconomic status are 1.6 times more likely to report depression. This is the risk ratio that we have for this. So the risk in having poverty is 1.6 for depression. And then you can see for marijuana, students who are in poverty are almost twice as likely to engage in marijuana use in the past month. And they're 50% more likely, 1.5 times as likely to report saying that they don't feel good about their future, which is awful. So the second indicator that we can look at directly with Minnesota Student Survey data is crime and violence. So the proxy here is feeling unsafe. Again, this is not a one-to-one correlation, right? So, but it is about how the students feel. So they feel unsafe. This MSS asks 4 different questions about feeling unsafe. One of those is about feeling unsafe in the home. But the 3 in this scale are feeling unsafe going to and from school, feeling unsafe at school, and feeling unsafe in my neighborhood. So almost 14% of Minnesota 8th, 9th, and 11th graders report feeling unsafe in their neighborhood schools or while going to and from school. And again, we can see how much of a difference feeling unsafe makes in the life of a child. So students who feel unsafe are almost 2.5 times more likely to have depression. And students who feel unsafe are twice as likely to use marijuana and twice as likely to say that they don't feel good about their futures. So this is obviously a very important factor in the lives of children. And the third indicator that I'm going to look at here is the racial and ethnic inequality. Again, it's really hard to measure historical trauma and the effects that that has on communities. And there are a lot of other things that are hard to quantify. But the Minnesota Student Survey does ask, have you been bullied because of your race or nationality? And the scale that we're looking at here, it asks them, have you been bullied once or twice? Have you been bullied once or twice in the past week? And then it goes up to more often than that, being bullied every day. So 3.8% of Minnesota 8th, 9th, and 11th graders report being bullied in the past or being bullied weekly or more often because of their race, ethnicity, or national origin. But when you look only at the students who are by POC, so Black, Indigenous, or people of color, 62.8% of those students reported being bullied weekly or more often because of their race or nationality, which is a huge burden to put on those children. So here, again, this is how much they report being bullied. I just want to add a little thing in here, a little push again about the Minnesota Student Survey, that we expanded the race and ethnicity options in 2019. So we actually have data now on some smaller subsets. So again, the Karen student population or the Ethiopian student population, which is really great. But you can see that some of them, 10% of them almost, are reporting being bullied weekly or more often because of their race or ethnicity. And again, what effect does this have on our students? It has really awful negative effects. So they're more than twice as likely to report having depression in the past 2 weeks. They're more than twice as likely to report using marijuana in the past month. And they're 1.6 times as likely to report not feeling good about their future. And so what do we do with these data, right? What can we do about this? We have to look at resilience factors, right? So some of the guidance from the CDC is that we need to strengthen economic supports for families. We need to promote social norms that protect against violence and adversity. We need to ensure a strong start for our children in schools and making sure that they have the supports necessary. We have to teach them resilience skills and other skills that they can use to succeed. We need to connect them to caring adults and have them involved in activities that give them joy. And we have to intervene to lessen intermediate and long-term harms. So there's a link for this document, but we're going to talk about some of these can actually be measured on the Minnesota Student Survey. So the first one we're going to talk about is one of the core ACEs, right? So having parental incarceration. This is about 16% of Minnesota 8th, 9th, and 11th graders report having a parent who is incarcerated in jail or in prison now or in the past. And these students are much more likely to report having depressive symptoms in the past 2 weeks. So then we can look at a number of the factors that affect this depression in students with incarcerated parents. So the effect is shown here. So of students that have had an incarcerated parent or caregiver, 53% of them report having depression if they feel that they're not able to talk to a parent about problems, right? But if they do have a parent that they can talk to about problems, the rate of depression or the prevalence of depression drops to 26.3%, right? So each one of these is protective in the lives of children who have incarcerated parents. So being able to talk to a parent about problems, feeling that your teachers and school staff care, developing a trusting adult with a relationship with an adult in an after-school activity, feeling that your relatives care about you, and feeling that school climate is positive. Each one of these things contributes to lowering the incidence of depression in students that have incarcerated parents. So again, building resilience in students with low socioeconomic status. So we saw the harm that low socioeconomic status has on students, that they're more likely to have depression, they're more likely to smoke marijuana, and more likely to feel negatively about the future. And this is the incidence when the students do not have these protective factors in their lives. But when the protective factors are introduced, again, we see pretty dramatic drops. Right? So just feeling that teachers and school staff care about you lowers the rate of depression from 37% in students with low socioeconomic status to 18%. And then again, students who are experiencing bullying. So this would be students who are bullied weekly or more often. What kind of things can help them? So again, feeling that the school climate is positive, feeling that teachers and school staff care about them, etc. All of these things will make sure that these students who are bullied are less likely to have depression or have depressive symptoms in the past 2 weeks. And then this one is just a little bonus one that I added on that has different protective factors. Participating in sports is another one that can lower the risk for students. This one happens to be about suicidal ideation in students with anxiety. So again, each one of these protective factors we can measure on the Minnesota Student Survey. We can look at the prevalence of them in your community, so you can measure how your community is doing, and you can build plans, right? So one way to explore the data that you have for your community, you can look at the core ACEs, right? And you can look at which ACEs are high, which are low, what services are tied to these issues. So maybe you need more supports in the justice system, right? So allowing young people to see their parents who are in prison, and which things need to be strengthened. And then we can look at the Minnesota Student Survey's non-ACEs data. So what are the rates of mental illness in the students themselves, and are they getting care for that, right? Even such things like, are they getting dental care or seeing a doctor? And then, is there high LGBTQ population? I know of one school district where, gosh, I can't remember what it is, but it's over 25% of the students report being in the LGBTQ group. So that would be a great opportunity to build supports for that specific population. Or if you have a lot of bullying, maybe to go with some social norms kind of based programs to deal with that. And then there are the Minnesota Student Survey protective factors. So which of the protective factors can be boosted in your community? What are the strengths that you have? And what do you need compared to the rest of the state? And then demographic data. This will start out with sort of your basic information. Are there any recent changes? Do you have a lot of immigration that you didn't have 5 years ago? Maybe there's this whole other group of people that have limited education or limited language skills, or have just had a lot of trauma in their background that they need dealing with. So which populations are prevalent in your community? And then looking again at crime rates, do people feel safe? Sometimes I have to say this isn't just about what the crime rates actually are, it's about what people think they are. I spend some time on, those neighborhood groups, and people sometimes have a feeling that things are much less safe than they actually are. But it's still important to look at people's perceptions. And then things like transportation. Does a community need to have a need for rideshare or something like that? And then also introducing the 100 cups of coffee, which is something that we use a lot in this group, looking at what the community values are, what the community thinks that we need. So, and then I have this little plug from Melissa Adolphson's presentation, which is happening directly after mine at 10:45. She is going to have concrete examples of how some communities have turned their data into action. So the whole point of this presentation is just to say we have a lot of great data in Minnesota, and we hope that you can use these data to build resilience and to acknowledge the adverse childhood experiences that do exist, whether they're the core 10 or whether they're ones that are specific to certain populations like recent immigrants or LGBTQ students or whatever. And then after, I will go back to the question page, but I just want to make sure that at the end of this presentation, I know it's been sort of data heavy and sort of word heavy, and they say not to do that in PowerPoint presentations, but it's hard when you're talking about data. I have a lot of the sources. So this is how to access your Minnesota Student Survey data for your community. This is where to get your non-Minnesota Student Survey data. This is by indicator. So I have 2 pages of indicators here. And then I have links so that you can find the data, because we want to make it as easy as possible for people to sort of do this analysis on their communities. So again, Katie, if you would help me, if there are any questions.
Yeah, so thank you very much, Jackie. I really appreciate how you sort of laid out a roadmap for everyone for finding their own data and all of those resources, and also the questions to sort of begin asking yourself. I think it's a huge resource that you've provided, so thank you. So folks can feel free to put a question in the chat and I will field them, and or you are also able to unmute if you'd like to ask a question that way. There was a quick, oh, did you see so there's a quick question about putting up the resources page so they could take a screenshot because they have a presentation on Monday that they could use it for.
I'm sorry, which shot?
So the resources page, maybe you could specify which page, Tanya.
So there's the MSS one. There's the indicators here.
Yes, the MSS one,
Okay.
I need data for individual schools. I have 13 across 3 counties that the schools want their personal data instead of it being all in one chunk. So there's not plausible deniability that it's the other school.
Yeah, so they can get their data by school district at the MDE site. So it's not necessarily easily combinable, or, it depends on the size of the school district. So some of them aren't large enough to have the data divided by sex and or grade, but each one of the school districts in Minnesota that participated, their data are available at the MDE website.
Okay, thank you.
Mhm.
Just a quick note. So there's a question about where the slides will be shared. So there's an event website for this gathering event where you can find all of the handouts and resources and links to join these. We're going to add the recordings and slides there. So you'll get an email with a link to that once they're uploaded too. There is appreciation for your pug in the question slide. Is that your pug?
Oh, it is not actually.
Oh, that was my question.
No, yeah, I have a Boston Terrier and a Min Pin.
And then there's another question, which is asking if you could say a little bit about the use of the term protective factors instead of talking about the assets as strengths, saying that they do so much more than help us just survive their building blocks of resilience. So.
Yeah, so I've talked about this a little bit before. I mean, protective factors is a widely used, protective factors and risk factors, I think is the lingo that we have. We have a module of developmental assets on the Minnesota Student Survey, but this is a trademarked set of questions, the developmental assets. I believe there are 17 of them on the Minnesota Student Survey. And it's trademarked by, oh my gosh, it totally went out of my head who they're from. But there is a set and they're called developmental assets, and we're not allowed to use that term because it's trademarked. So I think we stick to protective factors, and I think that's the language that a lot of people understand.
Could I speak to that question just quickly? So that's a real shock to me because developmental assets has been used widely in the literature for well over 30 years. I developed a model of 8 developmental assets and no one's challenged the trademark on it. It's a bit like
just for this specific tool, for the Minnesota Student Survey, for this specific tool, because we do have a module that is called the developmental assets, and we also have fact sheets that are about those specific developmental assets. So if we were to use those terminology to refer to other things that are in this specific tool that are not called developmental assets, I do think that that would be confusing. You can talk about what other kind of language to use, but this is a trademarked term that describes this specific module of 17 items that is used nationally.
Well, you're welcome to use mine. Say the reason I bring it up is really it's a matter of language, and it's that words do matter. And I don't think parents raise kids thinking, boy, if my kid could just survive. They have a bigger vision for their child, at least we would hope. And even just simple English terms like strengths connote something entirely different than a protective factor, which in the literature on resilience has been outmoded for 30 years. So I think it's a reactive and defensive term. And as an ACEs presenter and somebody who's trying to promote the concept of resilience and make it understandable to people and actionable, this just And like I said, I think it's just like we're trying to undo harm instead of move forward and say, how can we equip kids to address these problems that they're going to experience, the racial injustice that we have in our society. I mean, I'd love to change it, but in the meantime, I want to prepare kids to deal with it and not be knocked down by it and become depressed and hopeless about their future.
Right.
So it's just,
I think those are,
you know, I don't think we disagree what we're trying to do.
right.
And I'll shut up now.
Yep, I think those are great points. And so however the language is used, you know, there's always, I wouldn't say fads, but there are definitely like certain terms that are used at certain times to describe things, and it's sort of institutionally changing over time, right? So we probably will turn to different language in the future. And that's definitely something to keep in mind as we talk about it. So yeah.
Yeah, those are great points. And it came up in the chat too, that I think that we were looking for the Search Institute in case people were wondering about the developmental assets.
Yes, thank you. And on sumn.org, we have, I'm not sure, actually, I don't think it's updated for 2019, but we have fact sheets about the Search Institute's specific developmental assets, which are also very good, have great predictive value.
Great.
Okay.
There was a request to maybe, if you advance your slide, I think there was a request to just someone wanting to take a peek at the non-MSS locations for some of the indicators. Thank you.
So these are just the names, but then there's also here.
There you go. That's great.
And again, people can feel free to contact me. My contact information will be at the end, and I'm sure it's available on the website if people have questions about where to find data, or in some limited circumstances, like if it has to do with mental illness or substance use, I can help with analysis of your MSS data or finding other things.
Thank you. Very generous offer.
You guys, just a quick correction. It's the Minnesota Criminal Apprehension.
Oh.
Okay, Minnesota Bureau of Criminal Apprehension. Just make sure you have the word criminal in there, otherwise they might have trouble finding it.
Oh, yeah.
No
you.
problem.
Thank you. Oh yeah, crime apprehension. Sorry. Yep. I will fix that before this goes out. Thank you.
No problem.
Other questions from the presentation?
Okay, well, I hope everybody enjoys the sunny day later after all of the talks. I'm really looking forward. Again, Melissa Adolfson's talk is going to be about how to use these data in your community specifically, and she has concrete examples, which I always find really helpful, because I'm always like, oh, so we got all these data, but what are we going to do about it? People like to talk about, you know, a lot of language and get the vernacular down, but I want to know, what are we going to do on the ground? And Melissa will be talking about that at 10:45.
All right, there's lots of thank yous coming in for you, Jackie. And again, you'll get a link to the recording and the slides. And if you're not able to connect with Melissa's presentation, know that you'll be able to view the recording of that too.
All right.
All right, thank you all. Oh, actually, so wait, before I should give you a heads up about what's next. So we're ending a little bit early. The next breakout session is from 10:45 till noon. I'll share a link in the chat. So this is again that kind of the link to all of the materials and to next sessions. So there'll be another breakout session, and then following that, there's a mindfulness activity over the lunch hour that you can bring your lunch to. And then the keynote speaker, which is Dr. Diaz, who is the author of the Cherry Blossom Study and a leader in the field of epigenetics. He will be presenting from 1 to 2:30. So again, you can find the links and to all of that in the chat. Okay, Thank you all very much.
Thank you, everybody.
Bye.